So members are scrambling to vote, but I can always rely on doctors. Well, members of Congress are demanding answers after a recent study by the National Institutes of Health on gender procedures for youth turned tragic. 2 participants died by suicide. An additional 11 patients studied experienced suicidal ideation. Despite the study's alarming results, its leaders celebrated it as a success because these experimental treatments altered the subject's physical appearance. How could this fatally flawed study have been allowed to continue? Well, joining me now to discuss this is Dr. Quentin Van Meter. He's a pediatric endocrinologist and the immediate former president of the American College of Pediatricians, as well as an associate clinical professor of pediatrics at Morehouse Schools of Medicine. Dr. Van Meter, welcome back to Washington Watch. Thanks so much for making a house call this afternoon.
Happy to do so under the circumstances. Now, this effort by Congress to look into this is very important.
Well, let's talk about this. 2 youth suicides in a taxpayer-funded study of this experimental procedure of using, drugs and surgeries to deal with gender dysphoria. Why wasn't this stopped and immediately investigated after these deaths?
Well, it's very interesting. This study is at 4 centers, one in Los Angeles, one in San Francisco, Chicago, and Boston. These were centers that were already doing these kinds of pathway procedures, if you will, over a number of years prior to getting into a place where they could gather data. It's a very unusual study in that it's not like other studies where you have unified criteria across the centers, a set of consent forms that's uniform for the whole project, stopping criteria for serious adverse events, which could be something as simple as a hospitalization for complications related to procedures. And of course, death is the most serious of the adverse events. In those kinds of standard protocols, which we belong in our clinical studies, in which most people belong, they are governed by an institutional review board that's independent of the centers that are doing that. And they require a very strict consent form, an assent form for adolescents. They have a safety committee, which is a separate entity, which has no financial interest in any way with those doing the study. So it's a very clean and solid way to stop a study and examine it when things go wrong. That does not apply to this study for some reason. It's not a standard study. Nothing was standardized by it. Each center was doing just what they wanted to do and what they continue to do. And they call it an observational study to get out from under the regular kinds of regulations, which would stop this study in its tracks. Well, the sad thing is, the 2 deaths are unconscionable.
I mean, that raises a lot of questions. Why did the federal government fund this? Why did NIH fund this, given that it was not operating according to normal protocol?
Well, they kept it under wraps. When we knew this study was coming. We know these centers; they're key players for a long time in the gender industry, if you will. And so we saw this coming. We heard about it first. We went digging around, looking at where the grant money came from, the Kennedy Institute and through the NIH. And we said, wait a minute, how is this going to work? They're going to be doing things to children. And one of my colleagues, Dr. Mike Laidlaw in California, and some of his colleagues wrote a letter to I think Senator Mike Lee, who's saying this is a warning. You need to look into this study because it's not following the kinds of protocols and safety and protection of human subjects that it should. And we knew there was about $5 million thrown in for a 5-year study. And this data is just from the first 2 years. God knows where it's going to go from here. But it's perverse that they're using this study published, the first 2 years' data in the New England Journal of Medicine in January, as a study hailing success of their programs. It is an absolute sham with faulty reasoning, faulty representation. And I will tell you, I was at the Pediatric Endocrine Society meetings in San Diego just over this past weekend, and it was lauded by the interest groups as being one of the most concrete studies to show the benefits of their labor and their ideology, and clearly it doesn't show that.
And of course, they just want to roll over the laymen and the lawmakers with this type of stuff. Now, I read this, and I submit this to you to verify or not, but that many of the clinicians involved in these studies are known as gender medicine activists. So this is they are looking for these types of outcomes. Is that true? And if so, would that not raise questions about this?
Well, it should. I mean, in any other kind of subject, well, hopefully there are just a few subjects like this where ideology takes over science. But the circumstances here, these were all longtime activists. That prejudices the results going in. They designed the observational study to basically prove what they wanted to. They have a theory. We're right. This is what we should do. Anybody else who is against it is a bigot and a hater. So we're going to go ahead and design a quote scientific study that proves what we want to prove. And that's exactly what this is. It's just a self-prophecy situation with really some subterranean craftiness that is hurting patients, and the study in regular circumstances would be halted in its tracks immediately.
Dr. Van Meter, how many participants were involved in this study that you know of?
There were, I believe, over 350 from the 4 centers.
And what were the ages?
In this study, it was reported 12 to 20. And we know that some of the funding for this study was actually pulled aside by one of the investigators in Los Angeles and used to fund the mastectomies of girls as young as 13 and 14. That was not in the standard guidelines at the time, but we know this funding money was used for that. So there is fraud about this whole circumstance. Investigators in this thing should be called to question and governed and sanctioned if truth be known.
So based upon the treatments that were done here, these experimental treatments using drugs and, as you just mentioned, surgeries, what will be the long-term consequences for these youth that went through this?
They will be sterilized, first of all. That's the baseline of the horrific nature of the outcomes. On top of that, there is the side effects of the medications that create disease states that we have known about in medicine for as long as we've known about hormones and their effects, going back into the early 1920s and since. We know these disease states because we aggressively treat them to stop the adverse outcomes of excessive amounts of hormones that don't belong to the biologic sex of that body. And so there's plenty of data from top to bottom to show that every one of the drugs they're using has adverse consequences. The overall lifespan of the transgender population is half that of the U.S. population. And it's because they're creating medical problems that would not have otherwise existed. And these poor individuals not only are sterile, but they are sexually incompetent. They have no ability to have any real sexual function moving forward. When their organs are fried by cross-sex hormones, their brains are adversely affected with brain development in the adolescent age. Bone density is taken apart, and they end up having frequent fractures in adulthood because of that. It's just a panoply of disease that otherwise would not have existed if the child had been counseled and walked through the process, which is the real international standard of care, is to not medicalize this, but realize it's based on mental health issues, and resolving those mental health issues essentially resolves the transgender identification in 90+% of all these kids.
So Dr. Van Meter, is that why many countries in Europe that generally are more liberal than America on so many issues are pulling back from this and moving the other direction?
Yes, they actually did 2 what are called broad systemic reviews of every bit of published literature on the subject and came to the conclusion that there is no proven benefit to mental health and likely a deterioration of mental health with both the medical and surgical and even social affirmation of these children. So they have the data that's 10 years ahead of the United States. And that data said this is not beneficial and it's actually harmful. Therefore, we will cease and desist any minor receiving any social affirmation, medical affirmation, and certainly surgical affirmation.
It seems a bit ironic here that, they're kind of sweeping under the rug the fact that they had 2 participants in this commit suicide when this is why they say they need these medical experimentations. So, I mean, this is what many parents have actually testified to, that they felt pressured for their children to go through this process because the medical authorities said that, well, if you don't, you're going to have a dead child.
And there's a very telling statistic from the Tavistock Clinic, which had the largest population of kids that had been actually, affirmed in their incongruent gender, both medically and some surgically. The suicide completion rate, it was 0.03% in the patients that were treated. But the wait list of some 300 plus patients who had never received the treatments and were being followed nonetheless for their outcomes, these would be the untreated, those that didn't get their treatments. It was the same rate, 0.03% suicide completion. So that is manufactured misinformation of the greatest proportion. It's an evil, sort of a sledgehammer which parents are pummeled with. And the kids who want this to be done have read this online, and they are coached into using that as the bludgeon to make their parents sign forms for them.
What you just described is what's called a control group, is it not? Something that was missing in this NIH study.
Absolutely.
Let me, I know I can ask you medical questions, but medicine is also bound by ethics, and we learn from history. And when I look at a study like this and I look what's happening, I look back at the Tuskegee study and how, these things were done, a lot of them under wraps, but then when it's exposed and we're down the road a little bit, there's shock. And I'm just wondering if we are not in the middle of one of those moments where 20 years from now, people are going to look back on this in shock and horror that we allowed this to occur.
The problem is, you're absolutely right, and hopefully it will be sooner than later that the reality, breaks forth, and the world knows how evil this concept is of taking healthy children with mental health problems and throwing hormones and surgery at them to create a solution which does not work and never has worked. There'll be, by the time that happens, there's going to be maybe 1 million plus children around the world who have been permanently damaged. And that is the sad thing. My heart says we need to do this yesterday and have shut this down and never gotten here in the first place. It breaks my heart to see these kids who are really suffering emotionally so deeply, and they are told that that's the product of societal rejection, not essentially the core issue for them. And they're being glossed over and thrown into this protocol, this sort of conveyor belt of treatment, which I really think, as you said, in another decade or so, we're going to look back and say, oh my God, what were we doing? Reminds me of the experiments in Nazi Germany even. That's what the Geneva Convention put forward with the Nuremberg, sort of protocol for protection of human subjects. So this would never happen again. This was not to happen, and the guidelines that we in ethical clinical research use are being bypassed by this current study.
Well, and there is so much. I'm not going to say groupthink. I would say fear, even in the professional ranks, that with the exception of a handful of courageous men and women like yourself who are willing to speak out about this, the medical community is walking in lockstep with this agenda.
I will tell you, it's very unusual. I attended, as I said, the Pediatric Endocrine Society meeting, which is my national professional organization in my field. And for the first time in my medical career, to register for this meeting, I had to sign a check and check a box that said that I would not show any disrespect for any one of the presenters that we're going to be presenting, and that if in any way I upset the apple cart and made somebody feel uncomfortable, I would be removed from the premises and rejected from the Pediatric Endocrine Society. That's how afraid the core group is. They do not want anybody stepping outside the box. This is insanity.
Wow. Dr. Van Meter, always great to talk with you. Thanks so much for making that house call today.
Well, I'm so happy that I have a place where I can come and let all these things out of my person, because they stay bottled up a lot, and it's not really healthy to not be able to express frustration and let people know what's going on.
People need to hear it, and we're grateful for you doing that.
Thank you.
Look forward to talking to you soon.
Likewise.